CheckMate-8HW trial overview. Nivolumab plus Ipilimumab versus standard therapies for dMMR mCRC. Adults with MSI-H dMMR mCRC were randomized to receive either nivolumab plus ipilimumab, nivolumab alone, or chemotherapy. After 47 months, the combination showed a higher 3-year progression-free survival rate. The combination therapy achieved a 71% response rate versus 58% for nivolumab alone. Higher grade 3/4 adverse events with the combo at 22% versus 14% for nivolumab alone, with some treatment discontinuations and deaths. Dr. Thierry André from Sorbonne University suggests nivolumab ipilimumab might become the new standard first-line treatment. With these results, the combination of nivolumab and ipilimumab could become a new standard of care in the first-line setting for patients with mCRC MSI-H dMMR contraindications. MSI-H dMMR patients respond poorly to chemotherapy, but well to immunotherapy. Building on successful trials from 2015, aimed to compare dual versus single immunotherapy and against chemotherapy, included combo immunotherapy, nivolumab alone, and various chemotherapy options. Common events were skin reactions, colitis, with slight differences between arms, marketing authorization in Europe, reimbursement talks, and guideline updates. Nivolumab plus ipilimumab shows superior efficacy but requires careful toxicity management. It's emerging as a new standard, with patient selection key. Subscribe here and go to oncologytube.com for more info on this and many other oncology topics.